I'm Dr. Sharma. I'm a clinical professor of cardiology. I'm from University of Arkansas. I'm a chief of medicine at Medical Center of South Arkansas. It's a privilege to attend this heart conference, the World Congress. I thank Dr. Kimchi for that. And my topic was evolving role of platelet function testing. It is a very controversial topic. We had an excellent symposium here at the Congress on acute coronary syndrome. We all know that there's a growing population of patients who has coronary artery disease, who has acute coronary syndrome, and there's a growing number of patients who are on antiplatelet regimen. But the provocative question everybody asks is, how do you know that your medication you're giving to the patients are working? One of the ways to figure out is do a platelet function testing. This platelet function testing is a rather controversial test. It has not made to the guidelines yet. It is a 2A/B guideline on American College of Cardiology to consider in patients who are high risk, who has acute coronary syndrome, who has complex coronary artery anatomy, who are diabetics. So if those patients with those kind of clinical scenarios are on clopidogrel and you believe that your antiplatelet regimen may not be working, it would be reasonable to consider a platelet function testing. Now there are many trials. The Plato and the Triton, they have shown that new generation antiplatelet regimen works very well, and therefore they also have shown, by virtue of that, they have shown a significant mortality benefit. European Society of Cardiology actually have come up with the guidelines. They have indicated that in acute coronary syndrome patients, non-STEMI, the class 1 indication would be to use a new medication like prasugrel or ticagrelor, and clopidogrel is not in the guideline because clopidogrel may not work in up to 41% of the patients. And those are the patients you may want to guide your therapy by platelet function testing. There's many different kind of platelet function testing. For example, LTA, Verify Now, VASP. You need to get familiarized yourself with those platelet function tests, understand the pros and cons, and does have a utility in these kind of patient subpopulation. Thank you for the opportunity to talk to you very briefly. I think this is absolutely important. This is the one meeting I have seen where very diverse kind of research is presented around the world. You get, for example, I will tell you this symposium on acute coronary syndrome. There was a tremendous, excellent presentation from Dr. Peter, from Australia. And there's new innovative technologies which are emerging or presented at this meeting for the first time.